And on to something else that we're following. This is actually quite a good gesture at a time of a lot of sadness and people not being able to move about as they wish or they would wish on a regular Sunday. There is quite a good gesture here, and Setolale is at Mbagathi Hospital, where some well-wishers and I believe also people who are in the health sector have gone to provide lunch or to take lunch to their colleagues who are on the line, in the line of duty, in the front line, actively right now, taking care of patients. But he'll clarify this, Seth.
Yes, indeed, Mark, and it is, like you mentioned, it's quite a good gesture. And listen, this is happening right in the battlefront because we are actually outside the Kenyatta National Hospital Infectious Disease Unit, which is at the Mbagathi Hospital, like you said. And it's not just about offering that particular support for their colleagues. They are also in the forefront in terms of combating this particular pandemic ever since it was announced and confirmed in the country on the March of 13. But now, even to get a clear glimpse of how they're doing that, we're going to talk to the president of the National Nurses Association of Kenya, and I have here Alfred Obengo. And before I bring in Obengo, you realize that the nurses have been on the forefront in this particular war, and they have been sacrificing. Remember that they have, even suspended what used to be their regular off duties and also leave. And this is just to make sure that they are protecting fellow Kenyans who are being required to stay at home. And quite a good gesture. Today you've brought lunch to your colleagues. And how did you even think about it?
Oh, thank you so much. Our purpose today of coming to Infectious Disease Unit at Mbagathi Hospital was actually a very, very humble gesture from a Kenyan citizen, Katara, who actually sent me a message via Facebook Messenger that he was just following our conversation of how we are talking about our frontline warriors, the nurses, the doctors, and all other health workers on the front line. And she asked me if she could donate some food stuff so that as a gesture just to motivate and to stand by the frontline health workers, which we have organized and we are giving them today. We are offering that today.
Give us the numbers of the nurses, or rather the medics inside the Kenyatta National Hospital Infectious Unit. Remember that this is I don't want to call it a red spot, but it's a very critical area because each and everyone that has been confirmed is being brought here for treatment, and yet you're just, even risking your own lives to do this gesture. Tell us about, first of all, the numbers. How many nurses are inside there, or rather the medics who are conducting this particular critical and emergency operation, and especially on patients? How many are they?
From the statistics that we are given, because when you are bringing food, you must know how many people you're bringing food to. We are given a statistics of 50 healthcare workers who are inside, and they're from different backgrounds. We have nurses, we have doctors, we have records officers, we have lab officers, we have support staff, we have security, we have administrators, all of them packaged together. So we were told that today we bring a lunch for 50 persons.
Wow.
Yes.
Is this a one-off thing? Is it going to be persistent? And are you appealing to other people who would want to join this cause?
Thank you so much. In fact, we want to thank the nation media, NTV in particular, for coming to show the country this kind of gesture, because we will wish that, just like the president has formed the Emergency Response Fund, where we are having people and Kenyans of goodwill contributing to this war. We will wish also the people, also the Kenyans, other Kenyans, to come directly to us and contribute to the frontline warriors, so that we can motivate them. And actually, this is a gesture to show and demonstrate that we stand by our frontline warriors. And you definitely know that at this time, if you don't feed and take care of your frontline warriors well, then you lose the battle. That is why we are here, to stand with them and show them the solidarity that is needed.
And the solidarity needed is also required you to be having the PPEs. Just tell us about the procedure, because inside the wards, it is very critical. And so what do you use? Do you use some sort of PPEs, and where do they take this lunch from? Is there a designated area in form of a canteen? How is it done, literally?
Okay, another objective and purpose why we are here is to demystify this issue of fear and panic that people have. You know, in this environment, you must not don the full PPE everywhere. There are only sections whereby when you cross, then you must don the full PPEs. Where they are eating lunch, it's a free area where it's aerated. And this is not a prison per se, because we have also had patients being tested negative and being discharged to their homes. So it's not a prison that people should have that kind of stigma towards it. And that is the reason why we are also to destigmatize this whole hula baloo about COVID.
Finally, are we winning this war? From the forefront, you as the soldiers, are you winning?
If we take up the advice, the instructions, the measures that the President, His Excellency, the President Uhuru Muigai Kenyatta has given, if we take up the measures that our able Cabinet Secretary has given, we shall win this war. The only problem is that we are seeing this war as a government war, just like the CS said today. If you can take up personal responsibility to do whatever little you can to combat this war, we are going to win it. Because this issue of people assembling in a vehicle or closing themselves in a hotel and then they start partying, these are things that must stop if you have to win this war. Okay. So we are appealing to Kenyans to take up personal responsibility insofar as combating this war is concerned. This is the only way you're going to win it. But if you leave it just for the healthcare workers, that is their business, then we are not going to win it.
Okay.
Yes.
And of course, we're winning the war. That is according to Alfred Obengo, he wants me to call him the president of the National Nurses Association, and rightly put there, he is the president, he is the head. They just brought in lunch for 50 workers, their colleagues who are here at the Kenyatta National Hospital infectious unit at the Mbagathi Hospital, and they say that as much as moral support is needed in this, they also have to support them literally by just offering foodstuff, and that is a motivation much needed, especially during this time when Kenya is really battling the pandemic. And that is the update we have right now, Mark Masai. And of course, we know that the National Emergency Committee for the COVID-19 is meeting as we speak right now at the Ministry of Health offices, that is at Afya House. After that, we expect that the CS for Health, that is Mutahi Kagwe, is going to address the nation in regards to the status of the coronavirus pandemic. Mark.